Proper handling of research drugs.
This video is designed for physicians, nurses, data managers, pharmacy individuals, anybody who has a role in the investigational drug program.
In many different ways, a protocol works at an institution. It basically sets a standard of care that's the highest that we can obtain. In terms of the effects on the staff, it really increases morale tremendously. The staff becomes engaged in what's being done. They become more proud than they already are about the work that they're performing in the difficult area of cancer care and management.
This video was created to simplify and clarify the proper protocol for ordering, receiving, dispensing, handling, transferring, transporting, and returning FDA-approved research oncology drugs. As you view this video, we recommend that you have the NCI Investigational Drug Accountability Handbook at your side for easy reference. In 1977, the Food and Drug Administration initiated an agency-wide bioresearch monitoring program, the purpose of which is to ensure that scientific data submitted to the agency in support of FDA-regulated products is reliable, and that the rights and welfare of patient participants in the clinical trials are protected. The Bioresearch Monitoring Program requires investigators to establish a record of receipt, use, and disposition of all investigational agents. As a sponsor of investigational drug trials, the National Cancer Institute must assure the FDA that the system for drug accountability are being maintained by investigators in clinical trials. The standardization of policy and procedures will help member institutions and Southwest Oncology Group affiliates meet the requirements set forth by the FDA and NCI.
The Southwest Oncology Group, or SWOG as we call it, is a cooperative group of many institutions that perform clinical trials that require a large number of cancer patients. A member institution is one of the groups within a cooperative group that is responsible for the overall quality and monitoring of patients who are in these trials.
An affiliate is a research base at a separate institution from the member institution that has established a formal affiliate policy. A satellite institution is part of a member institution, generally close in proximity to the member institution and closely tied through affiliation agreements and shared staff. Only an investigator, usually a physician, who has an active NCI-assigned investigator number or their authorized designees, can order research drugs. At SWOG, the principal investigators of the member institute or the affiliate should order drugs directly from NCI. Satellite institutions should order drugs through the member institutions. To apply for an NCI investigator number, you must complete the Department of Health and Human Services Form FDA 1572. Detailed information on obtaining an NCI investigator number can be found in the National Institute of Health NCI Investigators Handbook, Section 12. This manual for participants in clinical trials also explains the responsibilities and the role of an investigator. Investigators are required to re-register each year. To order drugs from NCI, use the Clinical Drug Request Form, also identified as NIH Form 986. In addition to the procedures outlined in Section 9.1 of the NCI Investigators Handbook, NCI has established a system for receiving orders by fax. Refer to the new policy and procedure from October 1994. Send the completed form to the NCI Drug Management and Authorization section. Both the address and fax number are found on NIH Form 986. Order forms sent to NCI are handled by the Drug Management and Authorization section at 301-496-5725. Urgent requests faxed by 12 noon Eastern Time are delivered the next day if you provide an express delivery account number. With the new computerized system, an order is usually returned in about a week. In general, It is recommended that you order no more than a 6 to 8 week supply to avoid leftover drugs due to low usage or expiration. In certain protocols, the drugs are not distributed by NCI, but rather by a SWOG contract distributor. In this situation, ordering is usually done by phone. Because this process is protocol specific, members are encouraged to check the contents of protocols or call the SWOG operations office for details regarding proper ordering. When drugs arrive from NCI or from the distributor, there will always be a receipt in the package. It is critical that you check the information on this receipt to make sure you are receiving the correct drugs for the correct protocol, as well as the correct quantity and lot number. Oftentimes, NCI will enclose a blank return drug form, as well as a clinical drug request form, which should be filed for future use. After the drug has been checked in, note the date of receipt and file the form, as you will need it for your future SWOG or NCI audit. For certain protocols, the distributor may require the institution to return a copy of the shipment receipt to verify that the drug has been received. Therefore, it is important to read the instructions on the receipt or on the protocol itself to make sure all procedures are being followed. The next step is to verify that the drugs you received are in good condition. If you receive a broken vial or otherwise damaged drug, inform NCI, perform the appropriate documentation, and dispose of the drugs properly. Check the shipment date. If it's an item that requires refrigeration, make sure the drug has not been left in an improper storage condition that may affect the efficacy or stability of the drug. After the drugs pass your inspection, the next step is to sign the drugs in on your NCI Investigational Drug Accountability Record, NIH 2564. Instructions for completing a new form are found on page 5 of the NCI Investigational Drug Accountability Handbook. Directions for satellites are on page 6. Directions for filling out the form when you receive drugs from NCI are on page 8, figure 4. Please note that when you receive drugs with different lot numbers, you must make a separate entry for each. If you're using the same drug for different protocols, you must use a separate Investigational Drug Accountability Record form for each protocol. If you receive different strengths of the same drug, you must use a separate Investigational Drug Accountability Record form for each strength. Proper storage of drugs is critical. Some drugs must be refrigerated or kept frozen. Some need protection from light. Some require room temperature. All research drugs should be stored separately from commercially available drugs in a locked cabinet, refrigerator, or freezer. In some cases where these conditions are not available, a locked room with limited access is acceptable. For refrigerated or frozen drugs, keep a daily log of the temperature to ensure drugs are properly stored. Although not required, it is recommended that drugs be labeled by name, dosage form, and protocol number and stored in separate containers. In some cases, the same drug may be shipped for different protocols, and so separating the drugs prevents a drug from being used on an incorrect protocol. After the drug is signed in and put in storage, inspect the drugs that you have on hand for that particular protocol for lot number, expiration date, and balance total. Then, verify the information on the Investigational Drug Accountability Record. Some investigational drugs will have a preparation date rather than an expiration date. NCI will keep you notified of ongoing shelf life stability data. Before compounding a study drug, review the protocol to ensure that the proper technique and procedures are followed, thereby ensuring the preparation does not adversely affect the condition, stability, or efficacy of the drug. Nurses should be instructed on proper administration methods and techniques for research drugs. In the case of a randomized protocol, where the pharmacist is the only handler or provider who knows what the patient is receiving, it is essential to educate the pharmacy staff so that the information won't accidentally be provided to the patient or to other healthcare workers involved in evaluating the patient. It is very important that the correct drug is provided to the patient based on what they are randomized to. All of this information should be available on the protocol instructions. When dispensing drugs, check that you are taking the drugs from the proper container for that specific protocol. Then, sign it out on the Investigational Drug Accountability Record. It's important at this point to make sure that the balance on the form matches the balance you have in your storage area. For directions on dispensing a drug and how to complete the paperwork, see page 7, figure 3 of the Investigational Drug Accountability Handbook under Patient Dispensing Accountability. If you are working at a satellite or affiliate institution, the same procedures must be followed for compounding and dispensing drugs. See page 9, figure 5 for instructions on completing the Investigational Drug Accountability Record when the research drug is transported or transferred to a satellite from a control area at the same institution or to a satellite institution. When a drug is to be administered at a satellite pharmacy in the same institution or at a satellite institution, the control or central storage area must ship the drug. Include a shipment or packing slip to identify the drug by name, protocol number, quantity, lot number, and proper storage conditions. This will make the paperwork more complete for future audits. Carefully package the drug to minimize breakage and to ensure the proper storage condition. A drug that requires refrigeration, for example, should be shipped in a styrofoam box with blue ice. See page 10, figure 6 for instructions on how satellite institutions fill out the Investigational Drug Accountability Record when they receive drugs from the control or from a member institute. When satellite personnel receive the drug, they should always check the packing slip to identify the name of the drug, which protocol it is for, that the quantity and lot number are correct, and also check the expiration date. The condition of the drug should be inspected to make sure there is no breakage. After all information is checked, an entry should be made in the Investigational Drug Accountability Record, and the packing slip should be filed. Investigators are required to return NCI-approved research study drugs to NCI. For directions, refer to Section 15.2 in the NCI Investigator's Handbook entitled Drug Returns. In other studies, where drugs are obtained through contract distributors, drugs may be disposed of at the study site, but always check with the distributors or the protocol first to make sure you are not violating the requirements. Study drugs are returned to NCI when the drugs are outdated or expired, or if the drugs are damaged. When a study is completed or discontinued, or if there's an obvious excess in inventory, the drugs should be transferred to another NCI protocol, if possible, to avoid waste. Otherwise, return them to NCI. If you have a damaged container, such as a broken vial, check with NCI for directions on proper handling. When returning drugs to NCI, package them securely to prevent breakage. Returned drugs are not reused, so proper temperature storage at this point is not required. Next, complete the Return Drug List Form, NIH 986, which you received when the drugs arrived from NCI. Return drugs by regular mail to the NCI Clinical Repository at the address on the Return Drug List. It is required that you keep a copy of this form for future reference or tracking purposes. Lastly, enter the return to NCI or your member institution on the Investigational Drug Accountability Record. Directions are on page 11, figure 7 of the Investigational Drug Accountability Handbook. When drugs are returned to NCI, they are destroyed, so transferring investigational drugs is a way of reducing waste. There are two situations in which you would follow this procedure. When an NCI-approved protocol is completed and there is excess inventory, or when the drug ordered for an individual patient on a compassionate protocol is no longer required and you have another active NCI-sponsored protocol in the same institution using the same investigational drug. Use the NCI Investigational Drug Transfer Form, NIH 2564, a sample of which is found on page 14 of the Investigational Drug Accountability Handbook. Instructions are on page 15 and 16. Keep a copy of the completed form for future audits and send a copy to NCI. Directions for how to fill out the investigational drug accountability record when you transfer a drug from a completed protocol to another protocol are on page 17. In the event you have an excess inventory of an investigational drug, such as a slower than anticipated accrual or a temporary hold on accrual, it is recommended that you transfer it to another NCI-approved clinical trial using the same drug. In this situation, the investigator or designee must call NCI at 301-496-5725 to assure appropriate documentation of the transfer. Although there is no regulation or requirement that the institutions perform periodic quality assurance measures, it is recommended by NCI and SWOG that each institution performs their own internal quality assurance measures, including inventory checks for drug storage, documentation, and any related issues regarding investigational drugs. Audits by your cooperative group or NCI are infrequent, oftentimes only once every 3 years. If the investigational drugs are left without quality assurance or an internal audit for that duration of time, it becomes very difficult to retrieve information when the audit occurs. It is strongly recommended that an internal audit for the drug inventory, as well as documentation, be conducted at least every 3 months. This internal audit can be conducted by pharmacists, nurses, or whomever is the designated person handling the drugs.
Sometimes the people who are involved in just handling and storing the drugs, they probably don't feel like their role is as important as maybe the physician who is actually treating the patient. However, every little process has a value, and what we're looking for is to have synergy where all of us are working together for the good of our patient.
The importance of teamwork between SWOG and the National Cancer Institute cannot be underestimated, because the National Cancer Institute oversees and works with all the other cooperative groups. And so there is a great desire to obtain knowledge in efficient process as possible, and to expose as few patients as possible to experimental procedures before determining whether they work. And the other cooperative groups work with the National Cancer Institute to carefully set priorities so that important protocols are done in a very systematic but not duplicative manner.
SWOG perceives quality assurance as all of us striving to do the best job and provide the best service to our patients and to our customers. This video is just one of the tools that you can use to improve your quality control program of your drug accountability procedures.
Following proper protocol when handling investigational drugs protects the patient and ensures proper documentation of research results. By not following protocol, you risk becoming ineligible to order these drugs, and you also endanger the patients participating in clinical studies. Use this video as a tool together with the NCI Investigational Drug Accountability Handbook to ensure quality assurance in your organization and in your united effort to better understand and treat cancer.